in yesterday's sessions, we have discussed about the general skeletons of the back, as well as the associated structures. So now today, let's continue the joint and the ligament. You know, the two things, that means the joint and the ligament, are associated to each other. The ligament which gives an enhancing or giving a strength for the joint. So they are associated to each other. The joints that is found on the vertebral columns may be segmented into five types, which is a joint between the two consecutive vertebrae, and there is also a joint in between the two vertebral arches, the two consecutive vertebrae, and there is a joint as well without the cranium, which is craniovertebral joint, and as well the thoracic, specifically the thoracic vertebrae, which is articulated with the ribs, which is called costovertebral joint. Then lastly, the sacroiliac joint, the sacrum parts of the vertebral columns, which is articulated with the iliums, or generally with the hip bones, the right and hip bone, which is called sacroiliac joint. Now, specifically, we'll see majorly the above joint and the ligaments that are associated with it. Now let's start from the joints between the vertebral body. A joint between the vertebral body, generally the joint that is found in our body is segmented into three types of joints based upon the structure that binds the two articulating bones, which is the fibrous, the cartilaginous, and synovial joint. In the case of cartilaginous joint, there is a structure that binds the two articulating bones are a cartilage. In this case, there is intervertebral disc in between the two articulating bones. Therefore, the intervertebral disc here, it is a cartilage structure of four types of cartilage structure that will to serve as a connecting medium the two articulating vertebrae. And there is also a ligament highly associated with the joints of the vertebral body, which is the anterior and posterior longitudinal ligament. First, let's see the intervertebral disc. There are 23 intervertebral discs, which is extended up to the sacrums from, in the between C1 and C2, there is no intervertebral disc, because instead of intervertebral disc, there is odontoid process that articulate with the C1. Okay, so there is no intervertebral disc in between C1 and C2, or atlas and axis, and those account 1/4 of the total length of the vertebral columns, or most of the times the vertebral columns of an adult individuals, which measure out 75 centimeters, but 1/4 of it is formed by or contributed by the intervertebral disc. You see, this intervertebral disc, which is the binding medium, of the two consecutive vertebra. Here it is the bodies of the vertebra, superiorly and inferiorly, the another bodies of the vertebra, and they are articulated within each body, and there is an articulating medium, which is the intervertebral disc. And this intervertebral disc primarily, which is a shock absorber. And its size are vary from superiorly to inferiorly. For instance, in the cervicals and lumbar one, which is thicker, and which reflect the movement, the degrees of movements that is occur on those regions, on cervical and lumbar regions. And these ones, as you have seen here, it forms the anterior inferior walls of the intervertebral foramen. the intervertebral filament, which is the anterior wall, which is formed by the body, and some part inferiorly, which is formed by the intervertebral disc. Whereas posteriorly, which is formed by the articular process. The articular process. And this intervertebral disc, when you are seeing from superiorly, which is composed of two parts, which is superficial. There is annulus fibrosis, the annulus fibrosis, which is a fibrous structure, which is laminated, which is arranged in laminar and concentric laminae. And centrally, there is a semi-jelly structure, which is nucleus pulposus, the nucleus pulposus, which is a jelly structure and which is avascular one, So, which gains their nutrients by diffusion from the peripheries, the peripheral parts of the intervertebral disc as well, and from the bodies of the vertebrae by diffusions. Okay. Now let's see the ligament which associated with the joint between the body. Primarily, there are two ligaments, which is the anterior longitudinal ligament and the posterior longitudinal ligament. The anterior longitudinal ligament, which is extended from the skull, from the base of the skull, specifically from the coccyx, the occipital bones, specifically from the occipital bone to the sacrum, along the anterior surface of the vertebral body and intervertebral disc. Then, which prevents excessive extension. Backward extensions of the vertebral column. Okay, this one, which is the only ligament that prevent excessive extensions of the vertebral column. Whereas opposite to the this one, that means that lines the posterior surface of the body as well as the intervertebral disc, which is the posterior longitudinal ligament. And this one is somewhat weak and narrow, and which forms the anterior surface of the vertebral canal. The vertebral canal is found just posterior to this ligament. Now the other joint, which is a joint formed by the articular process, which is also called 𝑧𝒏𝒂𝒕𝒆𝒃𝒓𝒂𝒄𝒌 joint. The joint which is formed by the the superior and the inferior articular process, and which is a types of synovial joint, and specifically the plain types of joint. That articulation is formed in between the superior and inferior articular process of the adjacent vertebra. Therefore, this one is a synovial joint. If it is a synovial joint, there is a capsule, and there is also a space in between the articular space. And the articulating bones are interconnected to each other by a joint capsules. And the strength of these joint capsules reflect the angles, the degrees of movement. For instance, this capsule, which is loose in the neck regions, or in cervical regions, and as well in the lumbar region. That is why these regions are highly movable as well. So there is also a ligament that associated and give a strength and that increase the stability of those joints. There is accessory ligament that joins the consecutive lamina and the transverse process, as well the spinous process. Let's see those ligaments one by one. The supraspinous ligament. As the name it is, the ligament that passes over the spinous process. over the tips of spinous process, which extends from the tips of spinous process, which extends up to the superiorly to the C7, superiorly to C7 and inferiorly to the sacrums, that joins or interconnects the superior, I mean the tips of spinous process, This one, this thickening part is called supraspinous ligament, whereas the length or the longitudinal axis of the spinous process as well, which is interconnected with the adjacent one by interspinous ligament. This one is the interspinous ligament. And there is also other ligament, which is also called intertransverse ligament, which is not visible, which is a ligament that interconnects the two adjacent transverse process. Whereas the ligamentum flavum, which is a ligament, which is a short ligament and which connects the lamina parts of the vertebral arch. Here it is, this ligament and this ligament inferiorly as well. Okay, and this ligament also which forms the posterior walls of the vertebral canal. Remember, the anterior surface of the vertebral canal is formed by the posterior longitudinal ligament. Now superiorly in the neck regions, the supraspinous ligament starting from C7, which extends up to the base of the cranium, specifically which extends from the external occipital protuberance here up to the margins of the foramen magnum, which gives an attachment site for the base of the ligamentum nuchae, which is the triangular sheath-like membranes, which extends from the base, the cranium, to the apex of C7 spinous process, and they attach on the tips of spinous process of the spinous process of cervical vertebrae. This one is a strong ligament, and which is also prevent excessive flexion. Remember, except these ones, that means the anterior longitudinal ligament, which covers the anterior surface of the vertebral body, which is only prevent the excessive extension, whereas the flexion one, which is prevented the ligament that is found in this region, starting from the ligamentum nuchae, spinous process, I mean supraspinous ligament, interspinous ligament, as well. Those ligaments prevent excessive flexion. And this one's ligamentum nuchae as well, which is used for the attachments of muscles. There is a deep muscles. Mostly muscles are attached on the ligamentum nuchae as well. Now let's see the third types of joint, which is craniovertebral joint. The craniovertebral joint, a joint between the cranium and the vertebra, or simply the longitudinal axis, the joint that is formed between the longitudinal axis. As well, this one is a synovial joint, and there is no intervertebral disc here. And this craniovertebral joint, which allows and designed for a high range of movement. The bones that participate on the articulations of these craniovertebral joints are 3 in number. These are the occipital ones, the atlas, and the axis. The occipital bone from the cranium, and the atlas and axis is from the vertebral columns. And this joint is also segmented into 2 types of joint, which is Atlanto-occipital joint, the joint that is between the C1 and the occipital bones, whereas the Atlanto-axial ones, which is formed between the 2 vertebrae, C1 and C2. Look these ones. You see, this one is a C1, which is a ring-like bones. There is no body, rather there is a lateral mass on the articulation at that joint, at the points of articulations of the 2 arch. This one is the posterior arch, and this one is the anterior arch, and this is the odontoid process of C2. The odontoid process of C2. Now there is a lateral mass on its junction, which has an articulation facet superior that articulate with the condyles of the occipital bone. This one is the condyles of the occipital bone that articulate with the articular surface, superior articular surface of the lateral mass of C1, and which is a synovial types of joint, condylar types of synovial joint, so which allows a types of flexion and extension movement, as well as someone lateral flexion, which allow lateral flexion. Okay, the condylar types of joint, which is called Atlanto-occipital joint. The other joint is a joint which is created by or formed by C2 and C1. C2 and C1. In between, there are three joints which is formed by C2 and C1. One laterally, there is two articular facets. This one, the lateral inferior articular facet of the lateral mass, and there is medially the spinous, the odontoid process, which forms the pivot-like types of joint. There is a transverse ligament and forms a ring-like appearance that allow for the insertions of the odontoid process of C2. Now the Atlanto-occipital joint is condylar types of synovial joint, which allows flexion and extension and lateral flexion. And these types of joint movement is called indicating approvals of something. That means it is commonly called yes movement. But in the condylar types of joint, there is no rotational movement. And the ligament that associated with this joint specifically, there is anterior Atlanto-occipital membranes and posterior Atlanto-occipital membrane. Remember the anterior longitudinal ligament, which gives a continuation of the anterior Atlanto-occipital membrane, and the posterior Atlanto-occipital membrane, which is a continuation of that one, the let's see the anterior Atlanto-occipital ligament. You see, this one is the anterior Atlanto-occipital membranes, which is a continuation of the anterior longitudinal membranes, ligament, but at the same time, as you have seen here, it is somewhat thicker, but still, which is the continuation of the anterior longitudinal membranes, which is a continuation of this ligament. And there is also another ligament, which is anterior Atlantoaxial ligament, which runs from the posterior. That means this one's. That means the continuations of ligamentum flabum. This one is sorry. The posterior Atlanto-occipital membranes, which connects the posterior arch of the atlas to the posterior margins of foramen magnum. This one is the posterior Atlanto-occipital membrane, which is arised from the posterior arch. And there is also posterior Atlanto-occipital membrane. Which is a continuation of the ligamentum flabum, which connect the two vertebrae C1 and C2. Now let's see in medial sections of those how those ligaments are continued and gives those membranes. For instance, this one is a vertebral column. You see, This one is the vertebral column. And this one is the anterior longitudinal ligament. The anterior longitudinal ligament. But here, this one is a C2 and this one is the odontoid process. And look, this one. This one is the anterior arch of atlas or C1, which articulate with the odontoid process. With the odontoid process. Now, this one, the anterior Atlanto-occipital membranes, which is a continuation of this the green one, the green color one, which is the anterior the anterior longitudinal ligament. These anterior longitudinal ligaments, starting from C2, which is converted into anterior Atlantoaxial membrane, that means this one, and from C1 up to the foramen magnum, which is converted into the anterior Atlanto-occipital membrane. The anterior Atlanto-occipital membrane. Remember. Whereas these ones, the posteriorly, there is a posterior longitudinal ligament. This posterior longitudinal ligament is also converted into tectorial membrane, the tectorial membranes. The tectorial membranes. Mainly, this ones is highly associated with a joint between these ones, the C2 and the C1s, because which pass over the surface, the posterior surface of the odontoid process and C2. That's tectorial membranes. Whereas on the posteriorly, on the arch, this one is the vertebral canals, the vertebral canal. And posteriorly over the arch, there is also ligamentum flabum, which connect the laminae, and superiorly, which is converted into the posterior Atlantoaxial membrane and posterior Atlanto-occipital membrane. You see? This is therefore those two membranes are a continuations of ligamentum flabum. Now let's see the Atlantoaxial joint. The Atlantoaxial joint, which is three in number, two laterally in between, which is formed in between the inferior facets of the lateral mass of atlas, and the superior articular facet of C2, which is a gliding types of joints. That means plantar type, that means which allows a sliding movements of joints that allow sliding movement. Whereas the median ones, which is a pivot types of joints, this one is the odontoid process of C2, which is inserted within the ring-like structures of a C1. This ring-like structure is formed by the transverse ligaments of C1 and the anterior arch of C1. This one is the anterior arch of C1. Therefore, this joints collectively allows somewhat circular types of movement, rotational types of movement, or turns from lateral to lateral movements, somewhat rotational and turns from lateral to lateral. Look, these ones. The ring, which is formed by the anterior arches of the C1, and posteriorly there is a transverse ligament. And this arrow shows the types of movements that is occur on this one. Look, this odontoid process has a facet for the transfer process as well as for the arch. You see, this one is the odontoid facet for the arch. So which is attached by from both sides, one by articulation from posteriorly, and there is also a ligament here, Now let's see the ligaments that associated with specifically with this joint, specifically the pivot types of joint, which is the apical ligament, the alar ligament, and cruciate ligament. The apical ligament, which is as the name it indicates, which extends from the apex of the odontoid process to the margins of foramen magnums. to the foramen magnum, which is starting from the apex of the odontoid process, whereas the alar one, which is somewhat lateral to the apex ligament, I mean the apical ligament, and which connects to the occipital condyles, which connect to the occipital condyles. Whereas the cruciate ligament, the cruciate means by itself, which is crisscrossing. That means which has a transverse and a vertical part. A ligament that has a vertical and hello.
Wi-Fi
Hello, Barakat.
YouTube
Please mute. Hello, Barakat.
ሌላ ታሪክ ገብታለች አባቴ እስክትለምድ ነበረው
Hello, Barakat. Barakat.
Mute አድርግ
Okay, let's back to our discussions. The ligaments that are associated with the Atlanto-occipital joint. You know, those ligaments gives a strengthening and gives a stability for the joint. Look this one. Those ones, the cruciate ligament, which extended from the base, from the bodies of C2 up to the anterior margins of foramen magnum, which is the vertical one. You know, there is also a transverse part, which overlies the other ligament. There is the ulnar one, and there is also apical ligament, which is under the vertical parts of this cruciate ligament. I think let's see from that from medial view. This one is from the posterior view. The medial view. Here it is. Looks close ligament. This one is the anterior longitudinal ligament. Under it, there is cruciate ligament. The cruciate ligament. This one is a vertical part, and there is also a transverse part, which is cutted off. And from the apical part, there is apical ligament, which arises from the apex of odontoid process to the foramen magnum, margin of foramen magnum, which is apical ligament. Okay, those three ligaments. Of course, there is also alar ligament, which extends from somewhat lateral to the apex, the apical ligament, and which extends to the medial surface of the condyle, occipital condyle bone. Now the other ligament is a continuation of ligament, which is posterior longitudinal ligament. The posterior longitudinal ligament, which is the membranes, the pectoral membranes, which covers the whole those short ligament, and which is inserted to the somewhat superior to the foramen margin, from the margin, and which is basilar part of occipital bone, which extends up to the basilar part. You see, this pectoral membranes is insert over the basilar part of occipital bones. Okay. You see, this one is a pectoral membrane, and which covers the posterior surface and gives the anterior surface for the canal, the vertebral canal. You know, the vertebral canal is just posterior to this membrane, and this one is a transverse. I mean, the vertebral artery that ascends through the transverse foramens, and they join and gives the basilar artery that supplies the brain structure, and which enters through the foramen magnum. therefore, keep it in your mind that the structure that enter and exit from the brains, which is pass posterior to this structure, posterior to this structure. In other words, the vertebral canals, which is posterior to these ones. That means the anterior walls of the vertebral canal is formed by those structures, the ligament. Okay, the movements that occur on the Atlantoaxial movement, Atlantoaxial joint, that means the whole 3 joint, which allows somewhat rotation, and from rotations that permits the head turn from side to side, and which is also called indicating disapproval. So it's commonly called no types of movement. No. To say no, you can turn your head from side to side. So this types of joint allow such types of movements, or it is called no movement. Now let's see the neurovascular structure specifically that supplies the joint. The vertebral body, the joint between the vertebral body, they are supplied by a small branch of spinal nerve, which is meningeal branch. The meningeal branch. This meningeal branch, which is arise from the spinal nerve, and or it may be arise from sometimes from the anterior rami of spinal nerve, and which turn to enter the intervertebral foramens and supplies those joints, the vertebral body, the joint between vertebral body. Look these ones. This one is the super view of the typical vertebra with that of the nerve, spinal nerve. You know, this one is the spinal nerve, the right and the left spinal nerve. The spinal nerve, which exists through the intervertebral foramens, and after it exists, which gives 2 branches. This one is the posterior and the anterior one, the anterior rami and the posterior rami. And most of the time, look this branch, which is the meningeal branch of spinal nerve. But most of the time, this meningeal branch, which arises from the spinal nerve. That means before bifurcating into the anterior and posterior rami. Sometimes this spinal nerve, this meningeal nerve, which may arise from the anterior ramis of the spinal nerve. So which back and re-enter to the vertebral canals, and so which supplies the ligament and the structure, the whole structure that is found within the vertebral canal, starting from the spinal cord itself and the meninges, as well as the other vessels that is found within the vertebral canals. Look this branch, this ones, which is specifically that supplies the intervertebral disc as well as the bodies of the vertebrae. So primarily, this meningeal branch gives an innervation for the joint as well as the structure that associated with the intervertebral canals. Now let's continue to the other neurovascular structures that specifically that supplies the joint, which is the vertebral arch. You know, there is superior and inferior vertebral articulating process. Okay. There is superior and inferior articular process. This articular process, they articulate with its conjunctive vertebra and the joint, which is called vertebral arch, or the 𝑧𝒏𝒂𝒕𝒆𝒃𝒓𝒂𝒆 joint, which is called 𝑧𝒏𝒂𝒕𝒆𝒃𝒓𝒂𝒄𝒌, and which is innervated primarily by the nerve that arises from the posterior rami. That means this one is the posterior rami. You know, this one is the spinal nerve, which is divided into the anterior rami and the posterior rami. Look, this one is the meningeal branch that re-enter and enter to the vertebral canal through the intervertebral foramens. Now, on the posterior rami, is which gives the medial and the lateral branch. The medial and the lateral branch. The medial branch as well, which gives the articular branch. This articular branch which supplies, you see, this one is as well the articular branch. These ones and these ones as the 2 point. That means a specific nerve, at, that supplies the two articulating the superior and the inferior ones. Therefore, each joints are supplied by two nerves. Look this one. The inferior one also supplies this joint, and the superior nerve which supplies this joint. You see. Therefore, each joints are supplied by two nerves. The same is true for the vertebra, the joint that is occur in between the body, which is supplied by the two nerves, because these ones, when it re-enters through the vertebral column, which descend inferiorly and supplies and extends up to the inferior one, so which gives for the two vertebrae, vertebral joint, the vertebral body joint. Therefore, each joint they get two innervation from two spinal nerve. Now let's continue to the types of movements that is occur on the vertebral columns. The range and the angles, the range and types of movements that occur on the vertebral columns is determined by the articulating surface of the vertebrae and the ligament that's associated with the joint. For instance, flexion, extension, and lateral flexion as well, which is occur on the cervical region as well as within the lumbar regions. But rotational movement, which is somewhat occur on the lumbar ones. Mainly this rotational movement is occur on the craniovertebral joint, that means on the neck region, within the neck one. Okay, those is determined by different structures. For instance, one of the factors that determines the degrees of movement, which is the intervertebral disc, the size of intervertebral disc. If the size of the intervertebral disc increase, the degrees of movements also increase. If it is smaller, the degrees of movement are smaller. Now the other one, its natures of intervertebral disc. If it is more elastic, movement is more still, which is higher. As well as the orientation and shapes of the 𝑧𝒏𝒂𝒕𝒆𝒃 joint. That means a joint in between the articular process. And there is also a capsule. You know, the 𝒏𝒂𝒕𝒆𝒃 joint, which is a synovial joint. There is a joint capsule. The strengths and the tensions of this capsule determine the movements of the vertebral column occurs specifically on that joint. And muscles and ligament, the ligament and the muscle, tones of muscles and ligament, the positions of the ligament and its strength also determines the movements of the vertebral columns. For instance, the ligamentum flavums and posterior longitudinal ligaments, which determines or prevent excessive flexions. As well, it also prevent lateral flexion. The lateral ligamentum flavum also participates to prevent lateral flexions. And also the the thoracic region, the attachments of ribs also, which gives a strength and prevents somewhat types of movement, that means which help to more stable on or rigid, contribute somewhat rigidity. And the other structures that determine the angles, the degrees of movements in the vertebral column is the structure that is found within specifically the region. For instance, in the neck region, there is no more surrounding structures. But in the back, in the lumbars and in the thoracics, there is a lot of surrounding structures. So which also prevent freely movability or somewhat in a small manner. Okay, I think you can cover it by yourself. Let's continue to the musculature. Before that, let's see the vasculatures of vertebral columns. Look, this picture shows the arrangements of and the patterns of the artery that supplies the vertebral columns. You know, there are major arteries which arise from the regions of cervical regions, which is the vertebrals, and ascending cervical artery in the cervical regions, and on the thoracic and lumbar region there is also posterior intercostal artery in the thoracic, as well as there is lumbar artery in the abdominal one. Like this one is the abdominal aorta, which gives a lateral branch, which is lumbar artery. Let's see the pattern, how they are innervating, giving blood vessels for the vertebrae. Look, this one is right and the left branches of lumbar artery, which is the lumbar artery. This lumbar artery, which gives the equatorial branch as well as the spinal branch. Look, this one is the spinal branch and the equatorial branch. This equatorial branch which supplies the body, whereas the spinal branch which enter to the canal, the vertebral canal, and which gives anastomosis with that of the other branches of spinal artery, and which supplies the interior parts of the structure that's found within the vertebral columns, within the vertebral canals. Specifically, the radiocular and segmental artery, which supplies the nervous tissue, generally the nervous tissue. The segmental one which supplies the spinal cord, whereas the radicular artery which supplies the spinal nerve. Whereas when it is intact, which is bifurcated, the spinal nerve which bifurcated into anterior and posterior vertebral canal artery, and which this artery which also gives the nutrient artery that supplies the bone. And this one's laterally, which continues as the lumbar artery, which continues as and gives the posterior branch. As well, this posterior branch which gives the peristenials and nutrient artery, Therefore, the major artery that arise from the parent artery. In this case, the parent arteries are the lumbar artery. The lumbar artery is the parent one, and which gives a branch, the equatorial branch, as well as there is also peristenial branch, and the spinal one. Therefore, along its length, the vertebral columns, which supplies or gets a blood vessels innervation or irrigation by this manner. Okay. Therefore, those are the artery, the peristenial, equatorial, and spinal are a branch that arise from the artery from the cervical regions and from the trunk, which is inclusive collectively called segmental arteries. The arteries that is found on the trunk, which include what? The posterior intercostal artery within the thoracic cavity, and the lumbar artery and sacral regions, and in the abdominal region or lumbar region, which is called lumbar artery. The lumbar artery. Those are the parent artery that gives a branch for those artery. Let's see those artery. Let's see those artery. For instance, in the neck regions, the parent arteries are there's the vertebral artery, and which is a branch of subclavian artery, and there is also ascending cervical artery, which is also indirectly arising from subclavian artery, the subclavian artery. And in the thoracic region, there is a posterior intercostal artery, which is arise from the thoracic aorta, Whereas in the abdominal region, there is a subcostal one artery, a paired one artery, and there is also 5 lumbar artery, within the abdominal artery. And within the pelvic regions, there is iliolumbar, lateral sacral, and medial sacral artery, which is arise from the internal iliac artery. The iliac artery, which is bifurcated into two, the internal and external one. I mean, before that, there is bifurcated into common iliac artery, the common iliac, right and left common iliac artery. Then the common iliac artery is further divided into external and internal iliac artery. Therefore, this one is arise from the internal iliac artery, but the pattern and giving the branch is the same manner like this one. Okay, the manners of branching, giving a branch is the same. The only difference is the source of parent artery. This one is the parent artery, which is found in the abdominal aorta, and there is also in the thoracic cavity the posterior intercostal artery, and in the neck region there is vertebral and ascending cervical artery. Then in the pelvic cavity, that specifically that supplies the sacrum, which is the lateral sacral artery, the medial sacral artery, as well as the iliolumbar artery. Now let's continue to the venous drainage. Okay. እየተሰማችሁ ነው? ግን ይሰማል? Okay. So let's continue to venous drainage. There is a plexus. There is a formation of plexus within the vertebral canal and external to the vertebral canals. Then they drain to the parent veins. That is accompanied with the parent artery. Finally, which accompanied with the parent artery. The internal vertebral venous plexus, which is found within the vertebral canal, and external to the vertebral canal, there is the external vertebral venous plexus, which is found on the surface of the vertebral columns, and the external surface of vertebral columns. And they communicate to each other. By intervertebral vein. Through the intervertebral foramen. This intervertebral and the external one, they communicate to each other. Mind with these ones, the internal vertebral veins is also continuous through the foramen magnum, and which also communicate with the venous drainage of the cranium. That means the brain, from the brains, because this one which also continues through the foramen magnum. So therefore, which provides or gives us a route or serve as a route for infection transmission from one region to the other, specifically from the exterior parts of the body. That means drained by the external vertebral venous, and which is communicated with the internal one, which is communicated with the cranial cavity. You see, therefore, which is serve as a route for transmissions of infections. Finally, this plexus drain into the vertebral veins of the neck, the vertebral veins of the neck, and there is a segmental vein in the thoracic and lumbar regions, which is the intercostal vein, posterior intercostal vein, and there is also lumbar vein and sacral, like that of the artery. Intercostal vein, lumbar, there is lumbar artery, and there is lumbar vein that accompany the artery. Okay. Look, this one is the medial sections of the vertebral column. Look, this one is the anterior surface, which is externally, and there is also the posterior surface, which is the posterior surface. This one is the external one, the external vertebral venous plexus, which is divided into the anterior part. This one is which is found on the anterior surface, which drain from the vertebral body, and posteriorly, which is found posterior to the vertebral column, specifically from the arch, which drains from the posterior parts of the vertebral columns. And those external venous plexus which communicate to the internal one. This one is the internal, which is found within the vertebral columns. Again, this is the internal vertebral plexus is also divided into anterior and posterior one. This one is the anterior, which is lie from the posterior surface of the body, and posteriorly, which is associated with the arch and lamina, specifically the lamina. Then those communicate with the external one. They communicate through the external one. Look, this one is the transverse sections of the vertebrae from superior view. Look, this one is the anterior external one, and there is also posteriorly the posterior vertebral one, the vertebral venous plexus. They are communicated to each other with the internal one by the vertebral vein through this foramen, which is intervertebral foramen. Okay, and this one is the anterior intervertebral plexus, and this one is the posterior intervertebral plexus. Okay. Now let's continue to this shows the patterns of venous plexus. Look, this once it is extending the veins through these ones, and finally which drain to the parent vein. For instance, here it is the lumbar vein. And in the case of thoracic cavity, there is intercostal vein. Now let's see the nerve supplies of the vertebral columns. We have seen the nerve supplies of the joint, the 𝑧𝒏𝒂𝒕𝒆 joint, as well as the joint in between the body. Now let's see the structure that's associated and forms the vertebral column itself, and the remaining structures of the vertebral columns. As I was saying before, the 𝑧𝒏𝒂𝒕𝒆 joint, which is innervated by the posterior rami, which is divided into medial and lateral branch. It gives medial and lateral branch. The medial branch which supplies the 𝑧𝒏𝒂𝒕𝒆 joint, as well the body which is innervated by the meningeal nerve, the meningeal nerve. But also this recurrent meningeal nerve supplies the other components of the vertebral columns. let's see this recurrent meningeal nerve. This recurrent meningeal nerve, by the way, which gives the external and internal branch. This one is the external ones, and there is also internal branch. This one is the meningeal nerve, which gives the internal branch, that returns back to the vertebral canal through the intervertebral foramen. This one is the intervertebral foramen, where a nerve of spinal nerve exit from the vertebral canal. You see. Therefore, the external ones, which supplies the anterolateral aspect of the body and then the intervertebral disc itself, specifically the nerve which is also called annulus fibrosus branch. This one, the external one, and supplies the peristeums and the superficial, the external parts of the intervertebral disc, which is the annulus fibrosus, and the anterior longitudinal ligament. The anterior longitudinal ligament also supplied by this nerve. Mind you, this meningeal nerve also supplies this joint, which is a joint between the body, the two consecutive body. Whereas the internal ones, once it is inter, and which gives a transverse ascending and descending branch, and they supply the structure that is found within the vertebral canals. For instance, the meninges that cover the spinal cord, which is supplied by these types of branches of meningeal nerve, and the ligamentum flavum, the posterior parts of the peristeum, that cover the posterior parts of the vertebral parts, as well as the posterior part of annulus fibrous of the intervertebral disc, the posterior longitudinal ligament, and the blood vessels that is found within the canals are supplied by this branch. Okay, those are the structure that is found within the vertebral canal. So they are supplied by the internal branches of the meninges. Look, this one is a recurrent meningeal nerve, which turn and back to the canal. The meningeal nerve, which is also called recurrent, because which is return to re-enter to the vertebral canal. Once it is out and exits and re-enter to the canal, so it is called a recurrent meningeal nerve. Now let's continue with the musculature. Musculatures will continue after 10-minute break. So we'll continue our discussions after 10 minutes.